Hello, everyone. Thank you, Yap. Apparently, lunch was good, and people are taking their time to be back. Yes, as Yap said, my talk is an introduction to the next virtual session called Open House, focusing on new technologies, some of them already known for some years. I'll try and show how these technologies can help us in our work as epidemiologists. Now, the past months have been quite exhausting for epidemiologists with the COVID-19 pandemic, but we were also faced with an epidemic of armchair epidemiologists or Sunday evening news epidemiologists. And there has been, of course, an acceleration of the widespread use of new technologies. And there are apps for smartphones, for contact tracing, passive syndrome surveillance, and even focusing or following population displacement. These new technologies are going to stay with us, obviously, and I'm going to tell you briefly about 3 examples of what we can do. Smartphone use, image recognition based on the smartphone, and then a 3rd example that will be presented to you during the virtual stands. So we are going to see what can be done with smartphone apps, computer vision and visualization tools. And let's start with SMS Afya Yetu. It's a smartphone app, which means our health in Swahili. And this is developed with the MSF Foundation. This is an app that helps following patients with HIV and TB. For instance, in Goma, there's only 5 nurses and 1 doctor for 3,000 patients. And when the first COVID cases were identified in the city, we had to do something about the follow-up of patients who could no longer come to hospital. So this app can be downloaded on smartphones by nurses, and it sends automated questionnaires to patients via text messages. Patients can answer through using text messages as well. And then the app assigns medical follow-up tasks to MSF nurses. And finally, the data is centralized in the dashboard so that the MSF team can monitor the situation in the field, provide additional support if need be. Now, it's a good thing because it's patient-centered and patients can be more proactive. And it's also a way for MSF team to be able to follow more patients. In practice, a lot of technical obstacles had to be overcome because of DRC context. We also had to create a collaborative context and make sure that patients' data was treated in a confidential manner. This is still in a pilot phase in Goma. However, after this pilot, thanks to this pilot phase, we were able to fine-tune the app. And this cooperation with patients is something which is going to prove useful in the long run. And if you want to know more about this, I invite you to follow the session with Robert and Bashir. They're going to tell you about another app developed by MEDIC and the MSF Foundation for epidemiological surveillance in Niger. Let me turn to the second example, which is about computer-based satellite image analysis. It's a collaborative project with the GIS unit and the EU for Human team at the University of Salzburg. These new tools can, for example, automatically count all the buildings in a displacement camp to estimate the population size. It's quite exhaustive versus what you do with traditional or conventional methods, and it's also a way to save time. It can be repeated time and again to monitor the changes in the camps. However, there are some limitations to what a computer can do, and very often manual counting is still needed. Plus, these methods are usually on a case-by-case, and it's not possible to extend them more or to generalize them. And even if you can count the number of roofs, it doesn't mean that you know exactly how many people there are. So we need to further improve the detection algorithms and validate them by comparing them with other methods of counting people in the field. Now, I invite you to turn to Etienne and Lawrence during on their stand so as to know more about these tools to estimate population sizes and mortality rate. The third example is about visualization tools. They can be used to explore data in a fairly intuitive way. These dashboards are increasingly used by medics and communications and, of course, epidemiologists. In Epicentre, we started to come up with this sort of dashboard in 2016, and we realized that we had to change the way field teams organize data collection and share data. Usually when there is an emergency, a lot of pressure is exerted in order to collect data and communicate and forward large quantities of data with limited human resources. And a data management infrastructure that is not sufficient most of the time. All that was usually done on-site by people having the epidemiological knowledge, but not necessarily knowledgeable in ITIS. And since 2019, Epicentre has a data science team based in Paris and that supports epidemiologists in the field. For example, we provide more robust data collection tools that are better adapted to the field. We automated the cleaning up of the data to make it quicker, and we display that on screens that can be visualized online, and it helps the epidemiologists to carry out their sit-rep. During an epidemic, those dashboards are a single access point to the most recent data, which is essential for decision-making. And through their development, we were able to rationalize, to streamline the workflow and the workload. So epidemiologists have more time in the field because they spend less time on entering data. Yet, the use of dashboards implies changing our habits in a proactive approach on the part of users. It's not always easy to explore data.
We try to make it as intuitive as possible. And those dashboards come online. It may be a problem for the projects where you have limited internet connection. After 5 years of developing those epidemic tools, monitoring tools, and dashboards, we have to find a balance between automating data and adapting more and more to the needs of the field. We will show you the tool we developed for the COVID-19 pandemic. We can visualize the case management of COVID-19 in most MSF facilities. In conclusion, the new technologies are here with us already. They will be used more and more in epidemiology, either to create new tools or upgrade and improve those that already exist. Those technologies should always be adapted to the reality and the needs of the field, not the other way around. And their development is necessarily iterative, which may take time. Then I want to stress how important multidisciplinary mindset is and culture. It's by bringing various experts around the table that we can really put together promising projects. Thank you for your attention. And you will have a glimpse at the other technologies we present in the parallel session. Thank you.